Well, our makeup bag can sometimes be referred to as a cover-up bag. We have all those tools to hide the imperfections in our skin. But instead of covering up those pimples, those scars, why not just get the clear skin that you've always wanted? The team at Therese Aesthetic Medicine can certainly help. And Dr. Therese Stubbs herself is here to talk about breaking up with the breakouts, which we all want to do. So thanks for being here, Dr. Ann.
Thanks so much for having me.
So before we show everybody all the ways that they can get rid of acne, let's talk about what causes it.
Acne is basically caused by two things. Oils that kind of pack the pores and keep the pore from kind of taking its normal route of getting the oils out. It kind of gets a plug right on top, and that's basically what a blackhead is. It turns a little bit black on the surface because it's oxidized by the air. If that pore stays clogged long enough, it can get a little bit of bacteria underneath, and that forms the whitehead or the cystic acne, those big white cysts that a lot of teenagers have, and some young adults too. And sometimes people even get them after menopause. They kind of go back into some acne based on hormonal changes.
And that can be painful when you talk about that too, not just the fact that you don't like how it looks, but it can be an issue.
Exactly, especially cystic acne can be just very debilitating to people. They don't want to go out in public, they feel somehow deformed. A lot of my patients, when they first come in with very bad acne, they don't even make eye contact when they talk to you. They just don't like to go out in public. It really hurts their self-image.
And that is where you come in. You can treat acne a number of ways. Let's talk about first, you can do the things like you said, maybe good skincare, right? And you're able to offer medical grade things.
Exactly, and I think that is the first line of treatment when a teen or when a young adult comes in. We recommend a consultation and what's called an acne facial. And basically, this young lady that you're looking at right now came in with just some horrific, scarring and cystic acne on her cheeks. She was one that I was telling you about that wouldn't even make eye contact. She's a very pretty young lady. And after skincare with the medical skincare products for the next few weeks, routine acne facials once a month, coming in, seeing the estheticians and getting all that heavy oil and sebum cleared out of the pores. And on the retin-A, she was able to undergo 4 Fraxel treatments. Fraxel is a laser that can shut down that pilosebaceous gland, that sebum producing gland, and it can basically take away acne scars and shut down the oil production.
It's good to see that the scarring can also be healed, because I think a lot of people, they say, well, my acne's gone, now I'm just stuck with what's left.
Exactly, and they don't like the way that reflects in pictures. They say every time someone takes a picture of me with an iPhone, I feel like I have these divots in my face, and we do have lasers to address that. Different levels, with the Clear and Brilliant being a little more superficial and the Fraxel being the kind of the gold standard for acne scars. And you just saw a picture of our young lady who had 4 Fraxel treatments, 1 a month for a series of 4. Remarkable, not only shut down in her active acne, but basically taking away the scarring as well.
And Dr. Ann, something else when you talk about the chronic scars is you can actually use Bellafill for these as well.
Exactly. Some of the scars, and we kind of say if you can stretch that scar in the mirror and it smooths out, those are the scars that we can fill with Bellafill, which is a 5-year filler. It's a little bit of bovine collagen with some particles in it that generate your own collagen. So we put it right superficially in those little indents. This is a young lady who's one of our patients. She's a beautiful girl. She's a fitness model. She's always on the cover of magazines, and she doesn't like having to cover up those scars with makeup. So we did a couple of Fraxel treatments followed by Bellafill in the remaining scars, and she's been very pleased. You can see the results there. Just her skin looks much more smooth in photos, and just she can go to the grocery store now without any makeup on her face.
Yeah, she looks great. Let's talk about Clear Skin Saturday quickly. This is a big deal you guys are offering and an amazing opportunity.
Yeah, we find that a lot of people don't pursue any medical treatment for their acne, either because they don't think they can afford it, or they are by some social means can't get to a doctor. So we have one Saturday that we close the office to all people except people seeking treatment for acne, and we treat people free that day for anybody, maybe teenagers, maybe young adults who can't afford to get treatment or can't get in for one reason or another. Now, if they're under 18, we do have to have a parent sign the first time they come in, but we usually start with a consultation. We do what's called an acne facial, where the estheticians will clean out all the pores, and then we will donate to them all the skincare products, the medical skincare products they need. We've had one of these already in March. It was greatly successful. Our next one is May 21st. So if you know a teenager or a young adult or anyone who's struggling with acne who really is just kind of at their wit's end and frustrated with it, we invite you to call and get in on our Clear Skin Saturday.
All right, very simple way. Just call and make an appointment. Thanks so much, Dr. Ann.
Thanks so much for having me.